Hey everyone, welcome to OnBelay's webinar on getting the most out of your ACO experience. Today's presenter, Bob LoNigro, MD and Senior Vice President of Clinical Affairs at OnBelay. Bob, I will now turn it over to you.
Thank you so much, Alexis, and hello, everybody. Thanks for joining. It shouldn't be a stretch to think that all of us have not only heard about accountable care organizations, but have explored their value, and many of us have either explored or participated in one or more. To learn more about accountable care organizations, you can visit some of our other brief videos in the OnBelay series. Today, I'd like to focus on how you, the practitioner or practice leader, can ensure that you gain the most value out of your ACO participation. Unlike Medicare Advantage, Medicare fee-for-service accountable care organizations don't involve prior authorization or other complicated administrative requirements, but instead, success depends on a provider's excellent care, coupled with a supporting structure that helps anticipate and manage patient needs before they escalate to crisis events. Simply stated, no longer does savings depend on limiting access, but it depends on ensuring that enough care is being provided to support a patient's needs. For a long time, I didn't quite understand how better care could be provided at lower cost, because in Medicare Advantage and the Medicare managed or the commercial managed care world, it always seemed like services were being limited, often at the expense of patient outcomes. Accountable care organizations proved that by investing in lower cost interventions, specifically through effective care management programs that eliminate barriers to effective care and outcomes, address social needs, social determinants of health issues, et cetera, patients can decrease condition exacerbations and complications without requiring higher cost levels of care, like acute hospitalizations and emergency room visits. This was a great revelation to me, to be able to invest in early care, help my patients become healthier or stay healthier, and in fact, save money at the same time. Effective accountable care organizations do provide the tools not only to understand patient needs, but to actually support and or deliver the interventions needed to help patients decrease their barriers to good outcomes. This list on this slide shows you some of the many different barriers to care that have little or nothing to do with the clinical state of the patient, but more about what interferes with the care that you are prescribing for them. Using highly skilled care managers with a supporting team that includes clinical and non-clinical folks who can assist patient populations moving forward towards better outcomes at lower cost by helping fulfill the needs of patients that are less clinical, more social, and more supportive. You, the doc, provide the excellent care plan. We, the ACO support team, help reduce the barriers to getting that care plan completed. On the revenue side of accountable care, effective coding is best accomplished not by training each provider to become an expert, but rather by presenting the provider with detailed coding opportunities at the point of care, followed by a review of documentation and claims, to help ensure accuracy and completeness. Missing codes costs money. Incomplete documentation raises risk at audit. And so making sure that the ACO is ensuring both accuracy of coding and complete capture of claims is critical. We're in a care delivery paradigm that both plays to the strengths of our training, specifically providing high-level evaluation and management, but also challenges us to be more concerned about capturing all patient needs through correct coding and documentation. Rather than thinking about the care delivery model as a per visit exercise, thinking longitudinally about the total care of patients is what we all thought we were getting into when we went into medicine. The ACO moves us significantly down the path of achieving that goal. On-Belay Health Solutions partners with practices and providers to ensure success in the accountable care organization realm. Focused onboarding well before the beginning of the practice year, monthly engagement meetings with leadership and practitioners throughout the year as is required or will benefit the practice, technological solutions and very focused, efficient, and effective care management programs that work to move your patients along the continuum, coding support to help you succeed. On-Belay provides a partnership led by physicians for physicians. Thank you very much for participation and listening. And if you have questions, you can feel free to contact On-Belay. Have a great afternoon.